Good evening, our viewers in Nigeria and around the world, and welcome to the new year once again. You're watching Talking Health with Dr. Laz, your favorite health program on television. And my name is Dr. Laz Eze. Yes, earlier in the year, we started our conversation by reviewing the response to COVID-19 pandemic in year 2020. And since then, we've been asking all our guests what they want to see in the health sector in 2021. And you recall that last week, yes, we were on the street, and we are still on the street, getting to know the views of Nigeria. But today, I'll be bringing the concluding part of the interview with the Director of Family Health of the Federal Ministry of Health, that's the plans of the ministry in ensuring effective coordination, not just at the federal, but also at the state level to make sure that Nigerians get value for the money we are spending in the health sector, and also ensure that quality healthcare is something that we begin to, take for granted in our country. Let's take a break, and when we return, we'll be at the office of the Director of the Federal Family Health in the Federal Ministry of Health headquarters. Do stay with us, we'll be right back. COVID-19 is still here, the pandemic is still there. Make sure that you wear your mask properly, covering your nose just as I'm putting it on now. Don't wear for the jaw or hang it up somewhere, and keep protecting ourselves. It's been said that a lot happened at the federal level. And the federal government deals mainly with policies and coordinations, like you explained earlier. But the real actions are the states, local governments, and communities across the country. So Nigeria has some of the best health policies. But in terms of implementation, it doesn't translate, at least in the past, to better health for mothers, children, and all that. So with this new innovative approach the ministry is taking, how will it translate to better quality of service to Nigerians on the street?
So this is actually the crux of the matter, is to ensure we have better outcomes, matching our efforts at the national level. And what I did not mention as part of this partnership are also the traditional institutions and community leaders. They play a great role. So what will be the game changer, and this is what we want to work towards in 2021. We want to see that not only developing policies, frameworks, guidelines, building capacities, it just ends there. We all recognize the delivery platform. It's not the Federal Ministry of Health. It's not the federal government of Nigeria. The delivery platform is at the state level, subnational levels, and also at the local government level. That is where implementation must happen. So what we want to do differently, we want to support more closely the implementation at that level. RAMCA will be replicated at the state level. And our vision is to see replication up to the local government level. We want to advocate more. Even the Governors Forum are part of RAMCA. They were fully represented by the Director General of the Governors Forum. And why we did that is to connect the dots, connect the gaps that we have between the national and the state level, where the implementation happens. So there will be a very aggressive, result-oriented advocacy package and activities happening at the state level. We want to see more in terms of responsibilities taken. We acknowledge at the subnational level the efforts that have been made, but we want to see it translating into more action that you can really palpate and see in terms of more commitment, budgetary commitment to reproductive, maternal, newborn, and child health at the ministries of health. And also at the state level, the ministry is very clear with its own roles and responsibilities at the state level. The Ministry of Health also have some similar roles in translating the policies and frameworks into action at the state level. So we want to see more support from the national level in supporting the state to translate, domesticate, and adopt those policies for implementation at the state level. Exactly. More of capacity development role happening at the ministries of health. more of supervisory roles, because the role of the Ministry of Health at the state level, it cut across beyond the secondary healthcare facilities. They are responsible for supervision and implementation at the secondary level of care. They are also responsible, remember, private health facilities exist at the state level. Exactly. They are responsible for supervision, regulation of all the primary healthcare facilities at the state level, and to ensure that the primary health, the secondary, the private health facilities are practicing up to optimal level of standards. And in addition, they are also responsible for supervision of the state primary healthcare agencies at the state level. That is responsibility of the ministries of health as well. Despite the fact that MPSCD is providing all the national level support, but the ministries also have a supervisory role and a responsibility. So we want to tidy all those knots, bring them together, and have one holistic approach that will help us to deliver.
Thank you, Ma. The whole plan sounds very good. But many will argue that this is not really the first time that the Federal Ministry of Health has come up with some innovative processes and trying to drive actions that lead to better outcomes at the national level. We have the midwife service scheme that was very well intended, yet it hasn't quite led to significant improvement in our maternal health. We have the Save 1 Million Lives, also led by the Federal Ministry of Health. And all these have been targeted at improving the well-being of mothers and children in Nigeria. But yet, the NDHS, the various surveys still show that we have some of the worst health indices for mothers and children. So that shows that actions are not really happening as they should at the state level. Also, you talked about the supervision of private health facilities. It's almost non-existent from what I see, what we hear in the news, what we read of, in terms of the quality of care and standards. So that leads me to the next question. How does the Federal Ministry of Health intend to solve this? Will you be considering a peer review kind of mechanism? Will you be considering scorecard? Or ranking of states? Are there indicators to be tracked from input process to the output and outcomes? That could actually give those scores. To make states get involved in a positive competition in terms of results.
Yes, thank you so much. The whole idea is to get better results, but a lot has happened in the past. So what we want to do more this time is to put more efforts at the state level, up to the local government level. So once a state indicated interest and willingness, because it's all about the willingness of the state to drive it, you cannot impose. So, and we hope they have the buy-in, and this is what our advocacy activities aims to achieve. So once we have the buy-in of the state, RAMCA will be replicated at the state level. There will be capacity strengthening of the ministries of health that lead the affairs of the state, including all the relevant partners up to the community level, to take up that responsibility of harnessing all available resources, of making, if I may say, renewed commitment to the focus of where we are going, so that with minimal resources available, we can achieve quite big maximum impact and change the narrative on the health of women. Just like you said, if I may take example, we recognize the private sector provides almost 60 to 70% of health services in this country at the state level and at local government level. But in terms of supervision of what happens there is grossly inadequate. So part of the capacities that will be developed is along that line. And you talk about, of course, it has to be tracked. There is a tracking mechanism that will be in place. There is a monitoring and evaluation framework that will be attached to this, and this will have also the buy-in of the implementers, that is the state level mechanisms and managers or coordinators, and also the local government level. So we all agree on what are we going to track with clear timelines and commitments, and this will be tracked over every three months to see what is happening at the states that have committed to work with us on those. And then there are clear indicators that have been developed. How do we achieve this over this period? But at the end of the day, you look at now what number of facilities, if you look at it at the primary levels, that are able to provide a comprehensive reproductive, maternal, newborn, and child health services, including elderly, including adolescent health care services to the young people. So once these are agreed upon, we also have a timeline. And then you look at the funding. Funding is not going to be one source of funding. As we mentioned, the multiple stakeholders that we have, everyone have a stake in it, and everyone will contribute into resources, either material resources, fund, or whatever kind of resources that will complement to achieve the desirable goal. So it's a multiple sources of resources, but what is important is that all the resources will be coordinated under one roof, as you earlier said. Exactly.
Yes. So on funding, states, you've been a commissioner, so you very much understand this. States usually look up to Abuja for funding. And many interventions or innovations that are coming from federal to state, the next impulse is how much is following it.
Yeah.
So does this initiative have any intention of giving cash or financial resources to states, towards making this happen, replicating the RAMCA coordination mechanism?
So you see, Laz, what we want the state subnational level government to understand, they have the responsibility for provision of healthcare services to the citizens of the state. Whatever is coming from the federal government is complementary. It's additional resources. It's not a replacement funding. I think states need to understand that. Now, for instance, you've mentioned the Saving 1 Million Life. It's not a replacement funding to existing funding at the state level. At the moment, we have the Basic Healthcare Fund. The Basic Healthcare Fund is not a replacement funding. It's not going to cater for all the needs of Nigerians. It's an additional funding. It's a complementary funding. States should be advocated. State government should be able to dedicate resources for health for the citizens of their state. And when such opportunities come, they leverage such opportunities. So what we are advocating under RAMCA is sustainable financing. Sustainable financing from all sources, led by the state government itself. And at the federal government, led by the federal government. Tapping new additional resources, tapping resources even within communities that were never tapped before, to be deployed into it. So this is what we are advocating. Except until you have a sustainable financing and the state believes in it and on it, that is the only way they can sustain such programs. And these are some of the lessons we've learned from the midwifery service scheme. The state did not sustain it. We've also had the SURE-P program, if you remember, which was not sustained. So until we have a better understanding of the federal government resources that are coming, they are not replacement funding, but they are additional opportunities to support states to fill in gaps.
Yes, sir. Would you consider a kind of, do we call it a workshop, do we call it a training, do we call it just something that could make the operators or the managers of health at the state level, to perhaps begin to think differently when it comes to funding health? Because so many initiatives and policies that Nigeria has come up with, which some countries copied and implemented and got better results. But when we come up with it, it doesn't really translate because at subnational levels, they always expect that any policy direction led by the federal should be followed up with money. But Save 1 Million Lives had money, to be utilized, but yet we still not see much results. So what could be done to change that mindset, in order to get better results?
Yeah, I think changing the mindset and also believing that you are responsible is the task ahead of us. So what we want to do and what we plan to do this year, as I said earlier, is connecting with the state. The state will be on the driver's seat ab initio. So it requires intensive advocacy, awareness creation for the state to own it and then run with it. And then the states develop their own plans by themselves and replicate, and also identify the sources of funding. And even within government, the government should have a clear budget line. They already have a clear budget line for health in most states. We're also advocating, for instance, a clear budget line that goes into even procurement of family planning. Because family planning procurement should not be left to the federal government of Nigeria. It should come from the state resources. So I'm also glad to mention here that the states are not at the same level. Some states are doing well at the moment. Some states even have a budget line for family planning. Some states believe that the basic healthcare funding is additional complementary funding, while most states believe that it is a replacement funding. So we still have a lot of work to do in terms of getting states to reach the same level of understanding. And even those states that have that belief, so that they can sustain those efforts and continue to do it better. So this year, most of the work we are doing, when I talk about result-oriented, getting a result-oriented implementation at state level, is bridging the gaps between, it's not just putting policies and then dissemination, sending it to states, and then you find it on the shelves. We have to be at the state level to support the rollout of policies up to implementation level and get all the multiple stakeholders at the state level also functioning and having a common understanding of where we want to go. Except we begin to do that, we are not going to see changes, because we will still revert back to having silos implementation of activities, which does not make impact at the state level.
Yes, there's two more. Okay, yes, we're still talking with the Director of Family Health of the Federal Ministry of Health, Dr. Anas-Kolo, whose department is responsible for every aspect of our health, from reproduction to pregnancy to childbirth to children growing to adolescents to old age. We could say it's from cradle to the grave, and she's made so many points. We're going to take a break. And when we return, we'll continue this conversation. Do stay with us, we'll be right back. To Talking with Dr. Laz, your favorite health program on television. It's 2021, and we've been discussing the agenda for the Department of Family Health of the Federal Ministry of Health and the plans for 2021 towards making my health, your health, women's health, children's health, old people's health, and everyone's health, to be at the optimal level this year. So coming back to you, Dr. Salma, or Dr. Anas-Kolo, many civil society organizations have been pushing for accountability in the health sector. I'm aware the National Advocates for Health was partnering with the National Primary Healthcare Development Agency, with a scorecard to track the implementation of the Basic Healthcare Provision Fund. Some other CSOs also will be willing to kind of support this work that the RAMCA initiative, the coordination platform, especially in the area of monitoring. Will you be willing, or would your department be willing to share data, with these civil society organizations? And if yes, how best would they go about it? So that if there's some level of scorecard, to compare the states, because many times we say states are not doing well, but there are some that are doing well.
Yeah.
So we could separate.
Yeah, I'm happy you
that will help
raised
citizens to begin to hold the leadership accountable at the subnational level.
Yes, thank you so much, Laz. I'm happy you raised that. And as you are aware, the administration of President Muhammadu Buhari, I think one of the cardinal points what you want to achieve is to achieve accountability and transparency in governance. And in the health sector, I'm happy to mention that the Honorable Minister is really matching that to ensure that we have accountable system and very transparent system. So when the Honorable Minister launched the RAMCA, civil society were critical members of the RAMCA. And I'm happy to mention that the civil society are well represented in all the 4 subcommittees, because we came up with 4 subcommittees. One on leadership and governance and partnership, including coordination. The second one was on technical delivery, quality technical delivery. And then the third one we have on advocacy, resource mobilization. Then the third we have on monitoring mechanisms and accountability tracking. And in that subcommittee, we have several civil society members. And all these subcommittees, none is actually led by government. Most of the leadership, they came from civil society organizations. And why we did that deliberately is to enhance transparency and accountability. For instance, if you take the leadership group, it is led by one of you, Dr. Aminu Magashi. Okay. So he leads that. And some are led by professional organizations and academias. So we deliberately position it that way, so that it is not only led by government people, but also a mixed, especially with professionals and also civil society organizations. So they are already in it. When we develop the operational plan fully with the involvement of civil society organizations, and if you take the component, the subcommittee on monitoring, data management, and accountability, it was also developed by professionals, including the government partners, but more participation of civil society organizations, the operational plan, and all the tracking mechanisms. So because, and I'm happy to see that happening, because that is a step forward to see government working closely with civil society. And the whole idea, because if we really don't move away from not being transparent, we cannot achieve results. And this is to show you that we have moved forward to ensure that we are transparent, and we want accountability to be built into it. And part of what we realize is also building accountability systems within ministries of health. Within the ministries of health at the national level, at the state level. Not only, when I say accountability system, not only in the finance, but also in programs. Yes. In program implementation, you will have an accountability officer that is responsible for maternal, newborn, and child health. Because as a leader also, you have to account, have you implemented your activities?
So they will monitor the results.
They will monitor,
and
exactly.
We're making progress towards achieving
exactly.
the ultimate outcome.
Exactly.
So the operational plan.
Yes.
The operational plan you mentioned, how is it being funded, like the implementation of the plan?
So the operational plan is not attracting new additional funding.
Okay.
We are using the existing funding, and where we have gaps, we mobilize additional funding. And as I told you, it's not only owned by the government itself, it's not only going to be operationalized by government, but all development partners, community leaders, professional associations, they all have a stake in it. And that was why we call it the multi-stakeholder.
Yes. Any challenges so far?
Definitely we expect challenges because anything new that you want to do, you are expected to be confronted with challenges. You know, it's a new way of doing things. It's not a new way of having a coordination system in Nigeria. We've had it. But this time around, we want to see that it translates into real action, real results. So, of course, definitely you will have challenges. Government trying to work with civil society being on the part of the team, on the same table, and having the same ownership. Of course, you accept some resistance also from side of some of the government partners, but of course, this also requires a lot of advocacy, education, awareness creation, and also at the end of the day, what outcomes are we going to achieve? And we are beginning to see flexibility in terms of that. So these are some of the, and also silos. People are used to working in silos. You know, this is my own, this is what I want to achieve. And now we are not saying this cannot happen. So this is the government priorities. You have to fit into the government priorities. We have to implement together. You have to complement each other's efforts. So of course you are seeing resistance there, but with time, we expect partners also to key into it and ensure that all those are not happening. At the state level, definitely we will see resistance. You have already mentioned it. States see that federal government will provide funding, but now we are saying that state has to take responsibility for the citizens. They are doing it, but they have to do more. They have to provide funding, and this funding is not just being having a budget line above 5%. We've been advocating for that. You can have a budget line up to 16%, but the critical part of it also that we have to track is to ensure that whatever is budgeted is released, timely released of resources of the funding, and it is used for the intended purpose, with tracking mechanisms to see where it is going.
Ensure there is value for money.
To show there is value for money. So where we are tracking the economy, the value for money, you're tracking the efficiency, you're also tracking effectiveness of the resources. So all along those parameters, we have to track it and ensure that everything is working. So it's not an easy task, of course. It's not something that we are not used to doing, but we cannot just sit and say we can't do it. I think with the willingness, with the commitment, we can start and we will begin to see results. And community also have a responsibility as watchdog to see what is happening. So everything, it's about accountability. And then we are also using our maternal perinatal death surveillance review. Every death of a mother must be accounted for. Must be reported, must be accounted for. Not only in the health facility level, but also in community. So for instance, if a woman dies in a community, what is responsible for the death if it is associated with pregnancy, delivery? Who is responsible for taking her to the hospital? Why is she not taken to the hospital? What are the challenges? What happens? So there should be verbal autopsy right from community happening. And also at facility level, who is responsible for inaction that led to the death?
We are hoping to achieve, because I don't think this is happening in many communities.
It's not happening. It's happening in some pockets of areas because a lot of studies have been done, a lot of pilot projects have been done, and it has shown it is working.
And thank you so much for tuning in and listening. Please feel free to send questions, post your comments on our social media platforms displayed on the screen, and we'll always make sure that we provide feedback. And anyone we don't have answers for, we are sure that we'll get the answers and get back to you. So 2021, so much for the health sector. Please play your part. Let's all play our parts. My name is still Dr. Laz Eze. Thanks for watching. See you same station, same time next week. Bye for now.